So welcome everyone to the Healthy Aging Asset Index session here. I am Stephanie Vansky. I'm representing Healthy Aging Alberta, and I do have my colleague Beth Mansell also in the room here. So we're representing Healthy Aging Alberta. And then we have our guest here, Andrea Jones from Sage Seniors Association, who's going to present to us today about the index. So welcome, Andrea. And please, anyone, if you're joining in the room, please feel free to introduce yourself in the chat here. We will have time for a question and answer at the end. And I will pass it over to you, Andrea.
Okay, thanks so much, Stephanie. So good afternoon, everyone. My name is Andrea Jones, and I'd like to thank you for setting aside the time to take a closer look at the Healthy Aging Asset Index. Just want to do a quick check and see if anyone can see any of the pop-ups that are showing up on my screen. Is that showing through the screen share?
Nope, it's looking fine to me.
Okay, great, super. Just when each person enters the room, it's popping up. So just wanted to check. Okay, so we wish to begin today's overview by acknowledging the Indigenous peoples of all of the lands that we're on today, the traditional territory of 45 First Nations, and an ancient meeting place for many Indigenous peoples, including the Blackfoot, Cree, Tsuut'ina, Siksika, Piikani, Kainai, Îyârhe, Dene, Nakota, Saulteaux, and Métis Nations. We recognize that we are all treaty people, and as such, have a responsibility to become aware of our shared history and to understand the spirit and intent of Treaties 6, 7, and 8, so that we can honor the past, be aware in the present, and create a just and caring future built on friendship and understanding. We want to express our gratitude that we're able to gather today in this ancient gathering place and celebrate and honor its history. So again, my name is Andrea, and I've been at Sage as their adult educator for roughly the last 6 months, and it's been my role to develop and deliver the in-person Healthy Aging Asset Index training, or HAAI training. It really has been a privilege to land a spot on such a collaborative, skilled, and innovative team that includes Sage staff with over a half-century of experience in this field. That includes Bernice Sua, a social worker, previous director of women's shelters, a member of several Edmonton-based committees, and current director of operations at Sage. Then we have Karen McDonald, the current provincial director of Healthy Aging Alberta and executive director of Sage. Karen brings 2 decades of experience in gerontology, including 10 years in senior supportive housing, as well as an MBA to the team. We also have Anne Summick, Director of Nurse Practitioner Programs and full teaching professor of Nurse Practitioner Programs at the U of A. She has worked in primary care in 2 US states, was the director of a community-based clinic for seniors here at Sage, and currently works weekly in a local primary care clinic. And we have Beth Mansell, the provincial project manager of Social Prescribing Programs with Healthy Aging Alberta. Beth completed her Master's of Public Health from the University of Alberta in 2021. And prior to joining Healthy Aging Alberta, Beth worked at Sage for 5 years. So just a quick note, for anyone who's not familiar with social prescribing, I'm not sure who is in the room or not, it's an approach that connects people to activities, groups, and services in their community to meet the practical, social, and emotional needs that affect their health and well-being. So I'll share a few words about Sage. Sage is a senior serving agency with a 50-year history of supporting senior well-being and quality of life through wide-ranging programs, including housing and finances support in navigation, social prescribing, outreach, a safe house, and elder abuse education, free tax clinic, life enrichment and activity programming, community animation, a directory of senior services, a volunteer program, research, and more. and we're located in downtown Edmonton. So today we'll be learning about the HAAI, which is a holistic strength-based assessment and case management tool built for measuring the functional level of older adults. The HAAI offers several benefits, and each assessment produces a score that allows us to measure change. So more on that shortly. So this is what we will touch on today in the overview. We'll start off with some background, talk about the big picture and the development of the HAAI. And then we'll look at the opportunity that the HAAI represents and touch on some of its benefits and early impacts. Then we'll look at how it works, both from an agency view and look at the assessment process using a brief example. Then I'll share some of the tools that have been created, touch on the training and the toolkit, as well as who has participated to date. And then we'll close with some next steps, possibilities moving forward, and some questions. So before we go right into the content of the HAAI and how it works, I wanted to start by taking a look at the backdrop against which the HAAI was born and the future we're living into. So demographically, we're expecting our senior population to more than double over the next quarter century. So that means that by 2051, 1 in every 5 Albertans will be over the age of 65. And we will have gone from 673,000 seniors in 2022 to 1,391,000 seniors in 2051. So that number of seniors is expected to hit 1 million by 2035 and breach 1.2 million by 2046. That 80 plus age group is projected to more than double from just over 3% to roughly 7% from 2019. And that's a spike of 225%. So now we'll look at Alberta's regional senior population forecasts and what that looks like from community to community. By 2046, seniors are expected to form 20% of the population in communities of Calgary, Red Deer, and Cold Lake, with Edmonton and Lethbridge not far behind. So you can see this line over on the right side for 2046 and the bright blue bars. So that represents 20%. So we have Red Deer, Calgary, and Cold Lake butting right up against that line. And then we have Lethbridge, Edmonton, Grand Prairie just below. And then up above, some of the higher communities are Banff, Whitecourt, and Camrose, where we're going to exceed that 20% population share. So as seniors form a larger share of our population in the next 2 decades, the demand for health services, housing, and social supports will rise in proportion. With systems already falling short to meet the needs of today's especially under-resourced seniors, it's urgent that new ways of operating be developed. We need impactful ways to call for funding and resource increases, and effective practices to assess and support seniors today and into the next 2 decades. This is the opportunity of the HAAI. Grounded in the research that informed the World Health Organization's determinants of health, the HAAI gives us an opportunity to apply the research where it matters. Initially designed in 2018 by our nurse practitioner Anne Summick, the HAAI was born out of a need to measure the status and functional level of a uniquely complex group of seniors participating in SAGE services and the community clinic at the time. The tool was improved and refined by a team of nurse practitioners, nursing students, social workers, health navigators, and older adults themselves. In 2023, the development team was recognized by the Canadian Coalition for Seniors' Mental Health with the 2023 Vision Award. Specifically, the award recognized the team's integrated and interdisciplinary work supporting senior assessment and mental health intervention, and it's a big honor. The team was also nominated for the Community-Based Research Canada Award, Excellence in Community Campus Research Partnerships. This nomination recognizes the team for its substantial contribution to community-based research. And you can see the image on the right shows Anne and SAGE's Executive Director, Karen, with the Vision Award. So now let's talk about the benefits of the HAAI. The HAAI gives us the ability to assess and measure the health and well-being of seniors across 7 domains of life. And based on the results, discover new ways to reach and respond to senior health goals, to evaluate the effectiveness of interventions we provide, to create something of a new language that allows us to improve communication, collaboration, and understanding of a senior's functional level across medical and social services sectors and partners. It also helps us identify emerging trends so we can evolve and adapt our programs and services to respond to those trends. The HAAI also gives us that chance to powerfully demonstrate a case for expanded funding for senior serving organizations. So I'd like to speak directly to the frontline staff in the room who work with seniors. What if you had the ability to create something of a baseline measure or like a reference point where a senior's at in an area of life with such specificity that you could clearly identify all of the interventions that could move that senior forward toward meeting their wellness goals? What if you had a tool that gave you the chance to quantify and concretely see and celebrate a senior's progress over time? And knowing how much need and complexity you face each week in your work, how would that impact your experience of the work you do? And now, for those who work in an agency fund development role or an evaluation, what would it be like if you had a way to measure the impact of your programs and interventions? And a new way to tell the story and share evidence about the value of the work you do. And then for program and agency managers here today, what if you had a new way to identify and respond to patterns and trends amongst your participants and the ability to demonstrate the effectiveness of your programs and services in a way that funders and governments can truly connect to? Over time, as we progress with the use of the HAAI, this is the kind of promise we can look forward to. So we talk about the HAAI and its ability to make an impact. Well, here are some of the results. Pilot testing of the HAAI with 73 moderately frail older adults showed highly promising score reductions. And so when we say score reductions, that signifies improvement. So the lower the score, the higher the resilience and functioning. Also, to be clear, when we use the word frailty, this is what we mean. So many people have a particular perception of what frailty means. But in this case and project, we say that frailty is a state characterized by decreased function, leading to increased stress or vulnerability and increased risk of poor health outcomes. And that's from Rockwood. Okay, so what we saw in the pilot study is that a statistically significant reduction or improvement in HAAI score was observed for clients at the 12-month assessment when compared to their intake score. This reduction is equal to a drop of 4.1 points, which is an improvement of about 6.5%, controlling for age and gender. And the word is already being spread about the impact that the HAAI can make and measure. Members of the development and implementation team have presented on the tool at 10 conferences, internationally and domestically, also attracting interest in the tool from agencies in Ontario, BC, and abroad. Progress and results of the HAAI pilot test were published in the Journal of Health Research, the Journal of Aging and Social Change, and the Journal of Health Promotion and Chronic Disease Prevention in Canada. You can find links to those articles on the core website in the resources section and I'll also share links with you here this afternoon. So here's a closer look at the impact made in the pilot testing. Personal well-being and physical environment see statistically significant improvements from 6 months on. Mental health and social engagement see significant decreases at 12 months. So the chart that you see to the left highlights the score improvements we saw, and it's drawn directly from this article shown on the right. So what you'll see as we look at this is that the HAAI was designed to be completed with seniors 2 to 4 times over the course of their engagement with an agency. And this is what allows us to measure change from the baseline or initial HAAI to the follow-up assessments. So looking first at the personal well-being category, you could see that the initial average score was 0.84. So after 6 months, we see a 50% rough reduction to 0.42, and then another reduction of about 10% to 0.34 at 12 months. Similarly, in the physical environment category, the initial score is 2.26, which falls to 1.84, a nearly 20% reduction after 6 months, and then again to 1.34, which amounts to about 40% improvement within 12 months. Scores in social engagement fell by 33% on average, and by 14% in mental health in 12 months. Even at 6 months, the decreases we see represent powerful protective and preventative moves, especially for those agencies who are working with older adults over longer stretches of time. The opportunity to make, see, and quantify improvements to senior well-being is very real. Not only are the determinants or domains of healthy aging that we use in the HAAI drawn from peer-reviewed research and aligned with the World Health Organization's research-based framework for dealing with health holistically, but they represent a way that governments, social service organizations, and healthcare systems are starting to think and organize their work within and across sectors. Now, what is new is that the HAAI gives us access to capturing that snapshot of where seniors at over each of the 7 domains of life, and then to more effectively moving that needle toward greater wellness and reduced frailty. So as you can see, the domains in the HAAI include physical health, personal well-being, mental health, social supports, physical environment, social engagement, and safety and security. Within these 7 domains in the HAAI, we have the opportunity to take a reading on 21 factors of healthy aging and respond with the interventions to generate real movement toward better health and quality of life for older adults. So who's the HAAI for? The HAAI is intended for those it can impact for the better. These are people who are typically engaged in your programs over longer stretches of time. They're not actively dealing with a crisis or emergency situation, so they have the capacity and the bandwidth to look at different areas of their life. They're folks who are living with mild to moderate frailty, and they're living in the community. They're also folks who have some desire and motivation to make changes in their life. So we'll look next at what it looks like to implement the HAAI in an agency. Because agency service models can vary so widely, implementation of the HAAI into their programs can look quite different. Agencies may also differ in their motivations for using the HAAI and their capacities to apply it widely, which can shift their application of it relative to other organizations. Each agency will set their own objectives, their own target programs, and completion rates. They'll also decide whether they'll pursue research objectives with their data and establish processes that align with these parameters to guide their use of the HAAI in a way that works best with their unique programs and workflows, as well as data collection methods. Those who will be assessing participants will then undergo training, begin with initial and follow-up HAAI assessments, and inform process evaluation and revision. During actual HAAI assessments, the flow of steps starts with pre-screening participants. We do this to see who might benefit from more comprehensive assessment that the HAAI offers. This is done with the virtual frailty screen, which was adapted from the clinical frailty scale. So once a relationship has been established and a sense of trust and connection is present, the initial HAAI is then completed over 1 to 3 conversations if needed. And this includes setting the expectation and dates for follow-up HAAIs and collaboratively establishing goals and an intervention or asset plan. Next, interventions are implemented, follow-up HAAIs are completed, and a participant can either complete their participation or take on new goals and actions. So to give you a sense of how the HAAI works, we'll walk through a fictional case study over 2 sections or domains of the HAAI, starting with physical health. In this domain, we assess the factors of physical activity, physical health or status, and medications. For physical activity in the HAAI, we ask, do you have the physical strength to do the things you would like to do? How active are you able to be currently? For example, do you garden, walk, or go to the gym? And our participant answers, it's been hard to exercise since my heart attack. Even though I had a heart bypass operation, I still can't do too much activity without having angina. I also get pain in my legs if I walk too far. I can walk about a block at most before I get pain. I go out to get groceries, but it's a challenge. I need to take a taxi because I can't handle transit. For this response, we've selected a score of 1. We know that our participant is not bedbound, not homebound, and due to her limitations, she's not able to be purposefully active regularly. In the physical health or status question, we ask, how would you say your current physical health has impacted your daily life, if at all? And in our example, the participant shares, well, it's been hard for me to get out of my apartment. Some of the other people in my building go on some trips or go walking at the mall, but just getting to the mall is a challenge for me. I don't drive, so I need to take a bus, and the nearest bus stop is about 2 blocks away. I get short of breath really easily, and I can't clean my house well because I'm too weak. Home care can come and help me with my bath, but other than that, I'm on my own. The home care in the building hasn't been very helpful to get things organized for me. Based on this response, we would score a 2. We know that there are definitely some health impacts on her life from her health conditions. And knowing that 3 is the absolute extreme, we would select 2 as being moderate effect with multiple providers and an interfering effect on function. In the medications question, we ask, how many medications are you on? Do you feel confident about why and how you're taking them? She answers, I can't even remember how many there are. A lot. I have to get them put in those blister packs so I know when to take them. I was started on about 5 medications when I had the heart attack 8 years ago, and I also have the other medications for my thyroid and my pain pills, and the medications for my cholesterol, diabetes, and my high blood pressure. But if you put them in front of me, there are too many to keep straight. I also have a pill bottle with some sleeping pills because some nights I'm just too anxious to settle down. This response is a clear 3. If we look at the score description next to 3, we see that the prescriptions are greater than 5 and they include risk prescriptions. So we know that she is on several medications, including risk medications. So that would be a clear 3. Something to notice here too is that score descriptions can contain multiple factors and alternate factors. So assessors need to be interacting consciously with the descriptions in order to select the best score possible. So for the physical health score total, we landed at 6 out of 9, which indicates significant support is needed in this domain. Potential interventions could look like additional home supports for housekeeping, referral to supported transit or senior-friendly driving service, and confirming with the individual that they have access to a dedicated primary care provider to address their physical symptoms with activity. So then, in the physical environment domain, we assess the factors of housing, poverty, and transportation. In the housing question, we ask, do you have a safe place to live? Is it affordable? Do you want to continue to live there? So our participant answers, my apartment building is in a neighborhood that's a bit seedy, but the building is relatively secure. And it got much more challenging to get in after COVID. But sometimes, because it's close to downtown, people get in and set up shop in the stairwell. Good thing I don't take the stairs. I think I'd still stay there though because of the other Indigenous residents, but the rent keeps being increased, so I'm not sure. So for this response, we've selected a 0. When we look at the criteria for scoring a 0, we can see that the housing must be safe, supportive, stable, and affordable. We know that our participant has shared that the building is secure and it does offer some supports, including home care, so there are staff present. And for the moment, it is affordable. If the rent gets increased, though, we might score up to a 1. For the poverty question, we ask, is it hard to make ends meet each month with your current income? Our participant answers, age certainly is pretty tight. I find myself scrimping and counting pennies almost every month. So given this response, we have a clear score of a 2. We know that she's pinching pennies and it's almost every month. So that wouldn't be the absolute extreme of 3. And it's not sometimes, it's regularly. For the transportation question, we ask, how do you normally get to appointments and shopping? She answers, I have to take transit as I don't have a car. I also belong to a seniors driving service, which I might use if I have to go to the grocery store. So for this response, we've selected a score of 0. What we'll notice from question to question is that based on responses, seniors may seem like they would land in between scores, but since we don't have half scores, we need to make the choice to either score up or down. In this case, because we know that she's using the bus, she has some ability to use the bus, but she also uses a senior driving service. She does show some strength and function to have some independence. She's not fully reliant on the driving service, so we've scored to the 0 from 1. So in this category, we have landed at a total of 2 out of 9 for physical environment domain, and that indicates a limited need for support in this domain. Interventions could look like local financial assessment and navigation to ensure that Michelle's accessing all the benefits she's eligible for. So let's look at score total ranges and what they indicate. So a low overall score, as we mentioned before, indicates resilience and positive progress toward living well in community as someone ages. So you can see the score of 0 to 8 shows that these would be folks who usually don't require any interventions. Between 8 and 17 might require facilitation in one or more categories. And 18 plus scores show significant complexity and functional, social, and medical needs. Now that we've looked at why and how the HAAI was created, as well as explored its impact and benefits and how it works, we will look through the toolkit. The HAAI toolkit is intended to be a guide supporting HAAI assessment from start to finish and providing deeper reference and resource materials on scoring categories and alternate ways to frame HAAI questions. So let's take a look at each element. The virtual frailty screen that we mentioned prior was adapted from the clinical frailty scale, and it was designed to be used by professionals, volunteers, or lay people to assist seniors to self-assess their functional level. It can also be used to determine if further assessments, such as the HAAI, would be beneficial to an individual you're working with. Typically, the HAAI is especially beneficial for those who would self-assess them between 4 and 6 on this screen, which corresponds to those moderate frailty levels. The HAAI assessor checklist prevents the high-level flow of actions, ensuring that confidentiality, informed consent, and release procedures are followed. So here's a snapshot of the HAAI as it looks from within the toolkit. Each page features one of the 7 sections or domains and contains 3 questions that measure a distinct facet of each domain. So we've already seen that lower scores correspond with lower levels of frailty and higher resilience and functioning. Asset or scoring descriptions, which we've looked at already, offer guidance on which score is the best fit. So that's this area here. And our final 3 columns include the initial asset score, the asset plan, and the post-asset score. The color coding you see within the asset plan column aligns to the avoids intervention framework of the Canadian Frailty Network, which we'll look at shortly. The HAAI scoring reference sheet elaborates on the scoring descriptions in the HAAI to give assessors added clarity to support scoring choices. There are many nuances in delivering the HAAI, as well as gray areas in the circumstances of seniors' lives. So assigning a score can be a challenge, and the scoring reference sheet assists with that challenge. It also offers suggestions of when to score up or down. So in our example here for the mental health question, you can see that a number 2, what in dark green here would be what you would see on the HAAI. So mental health, moderate, interferes most of the time. The expanded description in this reference sheet says senior is living with a mental illness diagnosis that is considered moderate, meaning the senior is living with symptoms that make their life difficult at times. So our scoring note is to score down to 1 on this category if the senior is living with moderate mental illness symptoms, but appears to be managing well, taking medications, and is coping. So with 21 facets of life that the HAAI covers, each corresponding question is included to intentionally gather and measure specific information. If a question in the HAAI isn't well understood by a senior, or if it lands as highly sensitive or personal, being prepared with alternative ways of introducing those questions and asking them isn't just helpful, it's necessary. So this 9-page alternative framing resource shares prefaces and question frames for each question in the HAAI. The prefaces provided help set the stage and create some context for seniors to help them understand and answer HAAI questions fully. So our example of safety and security, the preface is where we live and spend time can contribute to our well-being in different ways. Making sure your environment is safe and well-maintained can help with your overall well-being. The alternative frames for this question include, tell me about your home. Is there anything about it that concerns you? Are there any clutter or safety concerns? And are you able to move freely around your home without having to worry about objects getting in your way? Is there anything in your home that might be a safety hazard? I also love the asset plan template in the toolkit because it lays out a summary of many of our important details for the HAAI, the care plan or interventions at a glance, and it creates clarity, focus, and forward movement. So while a database or digital path for collecting HAAI responses is absolutely recommended, we propose the use of this template to support the effective management of each individual HAAI assessment. So let's see if I can zoom in a bit here so you can see this a little closer. So we have our basic information at the top. We have our initial assessment date and our follow-up assessment date. Then we have our domain score totals, the total of the initial HAAI and the total of the follow-up HAAI, notes and ranges for reference. And then we have space for noting the client goal or goals, as well as the interventions that were selected, important dates and people and resources, and action items. The HAAI integrates the Canadian Frailty Network's Avoid Frailty framework to generate and group interventions that will build resilience and prevent or reduce frailty as part of each asset plan or care plan. So our Avoid Frailty acronym stands for activity interventions, vaccination, optimizing medication, interaction, diet, and social supports. So we encourage agencies to expand and tailor this intervention list based on their programs and available resources in their area. So that sums up our overview of the HAAI toolkit. The HAAI has been in use by assessors at SAGE since early 2023. And out of this experience, we've learned a lot about what works. And we've also established some best practices that make completing a comprehensive assessment work for our participants. These approaches have been included in the training provided to 18 organizations over this past season. The research possibilities with the HAAI data are vast, and discussions are underway with researchers to explore this potential. At present, several of Alberta's social prescribing teams are trained in HAAI assessment, representing many of the organizations shown on the right. Also, Greater Edmonton Foundation's Lodge at Otwell intends to pilot the use of the HAAI with the intention to measure the impact of their lodge services on residents. It will also help them to implement a new assessment mandate that was recently put in place. The Multicultural Health Brokers Seniors Coordinated Outreach is also piloting the HAAI with a small segment of participants that's engaged with them over longer periods. We're excited about the wide potential geographic reach of the tool and that participants from FCS offices, a primary care network, and a church joined in on the training. In the new year, we hope to better understand and support how each organization plans to implement the HAAI. So why is HAAI training necessary or important? When we set out to accurately measure and assign a score to an aspect of a person's life, primarily based on their response to a HAAI question, we're doing so in the face of a number of factors that can influence the outcome. There's the assessor's understanding of the intention and purpose of each question. There's the senior's understanding. Then there's the senior's perception of the whole experience, the assessor's personal relationship to some of the themes that the HAAI covers. There's also the degree of trust, safety, and connection between the assessor and the senior. And then, of course, the assessor's pre-existing experience with work like this. So the HAAI training gives everyone a foundation to start from, addressing the basics and the nuances, and includes both online and in-person training components to assist agencies in better preparing their staff to begin using the HAAI. The intention of the online training is to familiarize learners with the features and use of the HAAI. To accomplish that, it elaborates on each element in the HAAI, walks them through the scoring process, and gives them a chance to practice scoring with a case study. In the in-person training, we build on the foundation from the online component with partnered reframing practice, exploring best practices and the nuances of HAAI application, and live scoring practice with a more complex case study. So far, we've seen an overall positive response to the HAAI and training sessions. For example, participants have shared that having the HAAI to guide our conversations will help us cover all the bases. They've said, as mentioned, assessment was made mandatory for us, so we're grateful the HAAI is available. Some have said the HAAI will help us evaluate the progress seniors make and the effectiveness of the interventions. Others have said the HAAI gives us data, and we can use that data to improve our programs and share our impact with funders. Some have said the HAAI will help seniors see where they're doing well and help us create broader and more comprehensive service plans. And finally, some have said that we know the work we do with seniors makes a difference, but quantifying that impact will be very rewarding. We see the HAAI as a platform for senior serving agencies to expand and broaden their effectiveness according to their mission and service model. It's a way for us to shine a light on each area of a senior's life so we can tune our approaches and services to the holistic needs of older adults. Having completed the initial training round for Alberta agencies, we are now flowing into the reporting phase for the project. Following that, our goals include refining internal implementation and data collection, revisiting implementation with the agencies that received training, completing a high permission of use process to begin sharing the tool with agencies requesting it outside of Alberta, and explore research partnerships and funding opportunities to move this important work forward. So here are the 3 articles that I mentioned earlier about the HAAI and the virtual frailty screen. Feel free to screenshot this slide if you like, so you can explore a little deeper in the articles later on. As I said, they're also still on the core website in the resources section and on the SAGE website. So at this time, I'd like to invite Beth to join me and share any additional comments that she'd like to share. And after that, we can handle some questions. If anyone has them, you're welcome to use the chat to share your questions. And we can go from there. So I believe Stephanie will be spotlighting Beth.
No, you don't need to spotlight me.
Nope.
Keep sharing
Okay.
your screen. Yeah. I think that was a really great presentation, Andrea, and I hope that everyone else found it really informative as well. I think the only things that I wanted to add, I think from a Healthy Aging Alberta perspective, as Andrea had mentioned, we have offered the training to a lot of the social prescribing organizations that are part of our program right now. I think we see a big benefit for the Healthy Aging Asset Index in that social prescribing kind of pathway. And our hope in the new year as well, with the HAAI and with training, is that we can start to think about how we can adapt this training to potentially more of a virtual format, so that it can be delivered across the province. And then in terms of like long-term sustainability, I think one of the things that I would love to see is more of a train the trainer approach where we could have kind of experts in different regions of the province that have used the HAAI and have that level of expertise that could then be potentially training others in their communities. Because as great as it is for Andrea to travel to all of these different places and do in-person training, I don't think it's long-term sustainable for the sector. So that's our hope for the new year, and I really hope that Healthy Aging Alberta is kind of able to support the growth of this tool for different organizations across the province if people are seeing value in it. That's it. That's all I wanted to add.
Super. Thanks, Beth. And Beth has been on the project team since the beginning. So if you have questions, this is a great time to share them. Okay, so I'm just going to check out the chat. You're also welcome to raise your hand and unmute to share your question, but feel free to use the chat as well if you like. Okay, so Mark is mentioning that remote training is very helpful for those as far as the Maritimes. Yeah, absolutely. Okay, so these were some comments from earlier on. I would also be really curious to hear who else is in the room and how you might see the HAAI being of use or value in the work that you do? Okay, so we have two questions. So one from, oh, this is bouncing around. One from Pam. Will the training continue to be offered in the new year? Okay, so I'm gonna say that yes, although it depends on kind of where an organization is located. So any inquiries, please do send them my way. I'll actually advance the slide so you can see my contact information. And yes, we will be offering more training. So my information is there. And okay, I'm not sure if I'm saying this name correctly, but is it Karis or Charis? For those who scored low, when is it best to review? Okay, this is a really great question. We aren't necessarily setting our intervals for follow-ups around the scoring, although if you have a sense that an interval for a follow-up HAAI should be sooner or later, you can alter that. Within your organization, you will be setting kind of the general process for the length of time between the first, second, and third HAAI. So that would be something to review with your organization according to your objectives with the HAAI. What would you say, Beth? Anything to add there?
I missed the question because I was busy replying to people in the chat.
Okay, no problem. So it was for those who scored lower, when is the best
Yes.
time to review? I'm making the assumption that that means the best time for a follow-up.
Yeah, I think it depends on your case management practices and processes. I can say that in the social prescribing programs that are using the HAAI, they have an average of, I think, like 6 to 12 engagements or contacts with the person. That doesn't mean that they're reviewing the HAAI at each of those times. I think we recommend that the check-in points are kind of at that 3-month and 6-month mark. But I wouldn't say it's been something that we've considered for, oh, if someone scored lower than this, they should have more checkups, if that makes sense. Um, I think it's kind of been more of a standardized approach in terms of the checkups and the closing assessments. But that's definitely something that, yeah, could be considered in the future if people are thinking that it's more helpful to do a checkup sooner.
Yeah, and you can also consider the interventions themselves. So there may be some interventions that might take a little bit longer to implement. So that might impact your timing as well. Okay, so thank you. So next question is from Anne Marie. Could you kindly share if and how the World Health Organization is aware of this tool or engaged in promoting or utilizing it in any way? I'm unaware of this. Beth?
I don't believe so. We're just small little pieces of the big puzzle, and have no connections to the World Health Organization. So if anyone wants to facilitate those connections for us, I'm sure that would be appreciated. But yeah, it's not something that we've had the opportunity to do yet.
I love the big thinking though. That would be
Yes.
great.
Yeah.
Thank you. Okay. So next is Patricia. Would love the training online. Any idea of when we might be able to access it?
Yeah, so I was trying to type out an answer to this in the chat, but I figured it would just be more helpful to share it with everyone. I think it's going to take us a little while to kind of adapt the in-person component of the training to an online virtual format, just because the in-person training involved a lot of partner work, and role play and things like that, which is much more challenging to do in a virtual format. So I think the team needs to get together and utilize kind of feedback from the current training and people's experience with online virtual training to just be able to adapt that. We already have the first part of the training that's through an online module, but I think what's really important for the implementation of the HAAI is that engagement and that practice and role play. And so I think it's just going to take us a while. So I'm hoping that hopefully in the spring we might have some progress on that, because it's challenging to do all of that in person, but it's not something that we can just do tomorrow and have it, like, I think, go as smoothly as it does in person.
Yeah, I think that timeline might be feasible, and we will do what we can. So please reach out, send me a message, and I'll keep track of folks with their inquiries, and I'll let you know as things progress what timing's looking like. Okay. Okay, so these are a couple of comments. Okay, Amy, I think it is asking, does the HAAI currently exist only in a physical format, or is there also a digital version available? Well, the HAAI does actually exist on a web portal that can be used with seniors, for example, who are fairly tech savvy. Although it's not necessarily the ideal format, it is available digitally, not necessarily to be facilitated, for example, between you and a senior, but more as like a self-completion method. And yeah, other than that, it's the physical. Okay, good question. Pam says, will the training continue to be offered? We've touched on that.
I think the next question was, how much time does the HAAI need to complete?
Right. Okay. Thank you. Yes, Yuting. So the HAAI is variable. It can take, as few as 20 minutes. It can go to an hour and 20 minutes. It really will depend on the senior and how much they share. And as I mentioned earlier too, it can be done over 1 to 3 conversations if needed. So it's really going to be dependent on the person that you're working with, as well as your fluency with the questions and the flow. Okay, Amanda, what are risk prescriptions? Yes. Okay, risk prescriptions would be those prescriptions that would carry with them some potential interaction or potential for abuse or complication. And so we cover some of this in the in-person training. A couple of examples would be Xanax, benzodiazepines, sedatives, insulin, a few others. Okay. Let's see if there's a question in here. Okay. Another one from Karis or Charis. Who should be receiving the HAAI training for a seniors activity center? Okay, so really it would be whoever is most likely to be doing the assessment. I'm not sure that that's actually answering your question or if I'm understanding it properly, but I think I need to know a little bit more about how your senior center operates. Yeah, do you want to speak to that, Beth?
Yeah, I would say it could vary depending on the types of programs or services that you offer. I think the HAAI is best suited, as Andrea alluded to in some of the slides, for seniors who are kind of engaging in some sort of longer term relationship with someone else, right? Whether that might be like a case manager, whether it's a social worker, whether it's someone that's leading certain programs where there's support that's being given. I think the type of role could vary, but it's ideally someone that has a relationship or has a role that's engaging in some sort of longer term relationship with the older adult, if that makes sense.
Yeah, absolutely. Yeah. Okay. Miel says, are there in-person trainings being offered in the new year for folks who are interested in starting the training process? Okay, so there aren't any that are booked currently, and this could look differently depending. What we've done so far is training sessions in person for individual agencies or groupings of agencies. We haven't done, a training session that would include just individuals from various agencies, say virtually. That could potentially happen. But again, please do save my contact information and send out your, your inquiry, and maybe describe a little bit more about your agency and how many people might want to participate in the training, as well as your objectives or goals with it. And that will really help me when I respond to you. Okay, really great. So I don't see any more questions. We have a couple minutes left if you'd like to pop any further questions in the chat.
So while we're waiting for further questions, I just want to thank Andrea for this wonderful presentation, and thank you, Beth, as well, for being here. We are a little tight before the winter holiday, and I'm not going to lie, I am gone in a day, so this recording may or may not be up in the next day or so. I will send a notice to you as soon as it's up, so that you can, if you want to watch it or share it with somebody, but it may come in the new year. So just so you know, it might not be today or tomorrow, but it might come in the new year. But yeah, thank you, Andrea and Beth. And I'm going to stop the recording, but we'll still linger here for other questions coming in. I think there's one that just came in.